Thanks everyone for joining us again today. We really want to start off by thanking everybody for all the help and support that we've received so far. We've had a lot of people come forward to help with the fundraising, to help with sponsorship. Really, I wanted to share Lucy's story on her cancer journey because we think that that could help other people that are suffering with cancer. So today we're going to have a little bit of a chat on the sofa here and talk about Lucy's story and what she's been through over the past few years, right?
Yeah, 5 years.
5 years, wow. What made you think you had cancer? What made you start to worry about something that was happening with your body?
So we were down in Cornwall because we were seeing you at Easter, so it would have been technically this time 5 years ago. Just generally put a necklace on because we were going out for a meal for Easter, and I felt a lump on my neck, and it was on my right side of my neck, and just went to Mum because Mum's a nurse, and I was like, Mum, this feels weird. I've got a lump on my neck and it's huge, and she said, "Oh, just leave it for now. It's quite common to have a benign nodule on your thyroid." So I left it and then went back home, rang the doctors, went to see the doctor. They said that they were going to do blood tests, check my thyroid, because obviously if you've got like low thyroid function and you've got cancer, it all picks up with your blood tests. They were going to book me in for a scan. So that was that. They told me that I wasn't in any risk because I don't smoke, I don't drink, and that was it. That was what happened. So I had my blood test, waited to hear about a scan. When they checked all my bloods, my bloods came back normal. I rang them up and I goes, "What does the doctor want to do now?" And they said, "There's no follow-up. There's nothing wrong with your bloods." And I said, "But I've got a lump on my neck." So at that time I was on my own, that doctor, so I took Mum with me.
How big was the lump on your neck for people that...
So when they measured it, when I had the scan, it was about 4 centimetres by 4 centimetres.
Right.
So it was quite big, it was bigger than a golf ball. So I went back to the GP with Mum because they thought, she needs to see a doctor. When we got there, they cancelled my scan because my bloods came back clear, and Mum was like, "This isn't good enough, you need to go further." So they referred me to ENT, it was an urgent referral, so they see you within 2 weeks. So 2 weeks down the line, we went to see a consultant at ENT. I think it was a registrar of some sort, and they said it's just a nodule, it's benign. You're not in the risk factor, you're not the right age for thyroid cancer, you don't drink and you don't smoke. So that was that. So they
And you were 24 when this was all happening. You were about 24 years old at that time, is that right?
Yeah, I was 24, so I was still within the teenager. When you get diagnosed with cancer, you get special support in your teenager, and then when you hit 25, then you get support from Macmillan. So you get more support when you're younger than you are older. So I went to see, so they booked me in for a scan there and a biopsy. Waited a week or so for the scan and biopsy. They did an ultrasound on my neck. The doctor came in, scanned it, did a biopsy where they put a big needle in, and then they get tissue from your thyroid, from this nodule, to find out if it was cancerous. I even got told then, when I saw the doctor who was doing my ultrasound, that it wasn't cancerous or anything, it was just the nodule. So 2 weeks later, I had another letter to see a consultant. This time I saw a doctor. He was the specialist at the Great Western Hospital. I knew then that I wasn't going to have good news, but it wasn't then when they told me that it was cancer. So when I went to see him, they decided there and then, because it was such a big nodule, that they were just going to remove it, and they were only going to remove my right side, my right thyroid, and keep my left one, because my body can still function with my left thyroid, and that showed up as cysts on my left side and not anything cancerous. So another 2 weeks after that, when I saw the consultant, and they booked in my operation, and I had it removed.
You had your thyroid removed.
Yeah, my right side of my thyroid, because I can still run okay with my left side.
And that was a thyroidectomy, is that right?
Yeah, thyroidectomy. So what they did was, I was down in theatre. My mum and Martin, my husband, came with me. Got all ready, and luckily for that first operation, Mike could come down to the operating theatre when I was being anaesthetised for my surgery. And the funny thing is that it took them 5 attempts to anaesthetise me, to put the needle in, because since had cancer, my veins have kind of collapsed and quite harder for me to get blood out of me now.
Does that have other problems as well with your veins collapsing?
Well, they just find it really hard to find blood. It takes about 4 or 5 attempts, or it takes 15 minutes for them to get blood from me when it's dripping into a tube. So the funny thing is Martin came down to the down to theatre to the anaesthetised room, and actually he almost fainted at the sight of me being prodded 5 times with the needle, so they had to go and help him to get out of the room because he was about to faint, and I think he actually sat on the floor outside trying to catch his breath again. So I went into the operating theatre, had my surgery. It takes about 2 hours to remove one side of your thyroid. Went into recovery, and that was that. I was only in hospital for a day to make sure that my neck swelling wasn't anything too severe, and went home with a nice little scar, and that was that.
And we thought it was all over at that point.
Yeah, right? We did think that was all over.
We thought,
and we just
had the operation.
Yeah, and we just thought that was a nodule, because that's all we've been told, because I was not in the risk factors of having it. So yeah, 2 weeks after that, because as you have cancer, everything happens within 2 weeks of cancer. Went to see the consultant who did the surgery again to see if I was okay after surgery. They got my biopsy from my surgery, and I think the lump grew bigger then. At that point, I can't remember the size of it then. And I was diagnosed with cancer. I was with Martin at the time. Mum unfortunately couldn't come. But usually when you get diagnosed with cancer, you usually have a Macmillan nurse in the room with you.
Right.
And that's usually the clue, but unfortunately the Macmillan nurse wasn't there when I was diagnosed with it. I just had the consultant. And I had a registrar with him as well. And then he said, "I'm really sorry, Lucy, but it's cancer. You've got 2 types. You've got the papillary, and then you've got papillary,
yeah,
and follicular.
Follicular.
Yeah. So it's 2 different types. Really, for the younger age, you would get just papillary, and then the older age groups get the follicular.
Yeah. So it's unusual for you to have both. Right.
At a young age, at 24, and the follicular is the one that goes into your bloodstreams and then starts spreading around your body, so that's where the spread happens.
So people that have thyroid cancer that have the papillary.
Yeah, it's all self-contained into the lump.
Yeah, so there's really high success rates that they will remove the cancer via operation and maybe some treatment afterwards. But with usually, the follicular, it makes it much harder because it spreads.
Yeah. And it's in your bloodstream, so it's going around the body quite quickly.
Which means that your cancer that you've got can move from place to place.
Yeah.
And maybe we'll talk about where they've moved to in a little bit.
Yeah, definitely.
Sorry.
No, that's all right. You just butt in. And then they decided then, when I had cancer, that they would remove my left side of my thyroid, because they thought I had cysts on that side. So I think I had my first surgery was in June, and then they had to wait a few months for that surgery to heal, and then in September I went back in again to have the left side removed, which was the same process. Went into surgery, they moved it 2 hours, had to stay in overnight, and then I was away, take about a week to recover. that, September, I was back down at the hospital again to see if I was okay. I felt a bit sick and everything.
Were you on any drugs?
So
When
my
you were doing
first surgery, no, I didn't have to have any drugs, didn't have to have any thyroxine is what you get when you don't have a thyroid. I was on none of that. Usually your calcium can get affected from surgery and everything, so you have to take calcium tablets. But for my first surgery I didn't have that, and then I hit my second surgery where everything was removed. I felt a bit sick and everything. I was being sick in the toilet. I went to see my consultant the second time round after that surgery. I had to be put on thyroxine to replace what my thyroid used to do. So yeah, and they told me that the pathology decided that there was cancer in the left side of my thyroid. So that was that. And then they were just going to book me in for treatment, and this is where it gets a little bit complicated, because when I was feeling sick, when I was seeing my consultant, he requested I do a pregnancy test. And that's when I found out that I was pregnant with Harrison, and I couldn't have my radioiodine treatment till I had Harrison, which was, I can't remember now, it was about 6 months later. So we waited for Harrison. 6 months later, that was a whole rigmarole. I was under the consultant because of my cancer. I was on a really high dose of thyroxine because I was having to have more to be able to give to Harrison as well, so that his thyroid wouldn't be affected. So there was complications there for Harrison as well as me when I was pregnant. So then we had Harrison, 6 months later? And when he was born, they had to check his thyroid, because my thyroid could affect his, or not having one. And he came out all right. He came out all clear. September, I was actually meant to have my radioiodine treatment, and that had to be put on pause again because I found a lump in my neck again. So I went to see the doctor. The doctor then referred me back to GWH, Great Western in Swindon, and he checked that there was a lump there. And then, because it was on my lymph nodes, it was a slightly complicated operation, and it's slightly more complicated.
So yeah, they found another lump on your lymph.
On my lymph nodes on my right side again.
So then you had to have an operation for
But what they had to do was they had to then refer me to Oxford, because it's more of a complex surgery.
Right.
So as it's more complex, I was then referred to Oxford, and then 2 weeks later I saw a consultant in Oxford, and he decided, when I saw him, 2 days later on a Thursday, I had my surgery. So I saw him on the Tuesday, and I think on the Thursday, before he was going away, on the Friday, he booked me in for my surgery. So I did all my pre-assessment on that Tuesday, ready for the Thursday operation. And in between that time, you've got to go for a scan. So in Oxford, they make sure they scan your chest and everything to make sure that the cancer hasn't spread anywhere else in your body. It's to see where it is in your lymph nodes. So on Thursday, I went down. Usually, I'm always the first one for the operation. And then they do when you have lymph nodes, they do a neck dissection, which was all on my right side, and they actually, I think they removed about 20 lymph nodes from my neck, and I think it worked out about 4 of them had cancer. So they did all that, and then I woke up. I had to have a drain this time in my neck, which is like a pipe, and then you got blood dripping out from your neck into a collection bottle. It's lovely.
Yeah.
And then next day I was allowed to go home. I think the worst thing was when they had to pull the tube from my neck out. That was really painful. That was awful. And then that was it really. That was my neck dissection. It's like a nice big scar. It goes up towards my ear. Since then, they told me in my operation that I would probably lose sensation in my side of my face for a little while, for a few months, but I've had it now. I've lost sensation in my right side now for about, I'm going to say 4 years, where it's not the same. When I touch my face, it isn't the same as when I touch my left side. It's a little
What's it feel like? Plasticine or something?
Yeah, it feels like really numb. So
Right.
like that, I can really feel.
Right.
But when I touch that side, I can't really feel it. I can't feel it to put my earrings in. You usually have to have help from Martin to put them in.
Did you have some problems with your arm as well?
So after my surgery, because my lymph nodes are being damaged and the fluid doesn't go out my lymph nodes as normal as like someone else who hasn't had that operation. So I've now got lymphedema in my right hand, which then swells up, and then it's like a collection of fluid. And then it goes all the way up, shoulder pain, and then in my neck, I've got like a little bulge on my neck now. So yeah, it was all fun and games at that point.
So that was your last operation that you had?
That was my last operation I had.
And then the treatment started?
The treatment started, in September. It actually started in September, end of August, September.
So what is the treatment that we're talking about here?
The treatment is radioiodine, and it's called iodine 131. So that's an interesting story.
It's a radioactive.
It's radioactive.
Isotope that they use to help destroy cancer cells, but the, I suppose, cool thing about it is that it only targets thyroid cells.
Yeah.
And it only destroys thyroid cells. So Lucy's cancer had clearly moved by the time she had treatment. So this treatment meant that it would be able to kill cells anywhere in Lucy's body. Yeah. In fact, when you had the treatment, it would kill cells anywhere in the room.
Yeah. Saying that, actually, I did miss that off the operation. Is when I woke up, when I was put into recovery, they did tell staff to watch. So they said watch because she's got suspicious nodules on her lungs.
Right.
And the next day, when it was playing on my mind, I thought, that could be me, because obviously got cancer.
Oh, that was when you were coming around, wasn't it?
Yeah.
And you overheard a conversation that they were having that you shouldn't have heard, basically.
Yeah. So the next day I asked, it wasn't the person who did the surgery, it wasn't, because it was his registrar came along and saw me, and I goes, I just heard when I was recovering that they said something about suspicious nodules, and I was just wondering what was that about me, or was that about somebody else? And they said, actually, yes, it is about you. And that's when they found that I've got thyroid cancer nodules on both sides of my lungs. So then that makes the radioiodine treatment more hard. It makes the radioiodine more harder for it to attack the lungs, because it's harder for the cancer to get rid of in your lungs, basically.
Right. When it breaks down, like when it.
So what
it can't remove.
It's not as it removes it, but it's just harder to remove. Right. It takes more sessions.
Yeah.
To remove. So then in September I had to recover from surgery, and then I went into. I got a phone call and they booked me in for my radioiodine treatment then. And then went in, had my own little room.
So you go into, this is at Oxford, you had the radioiodine treatment?
Yeah, they only specialise it in Oxford for the radioiodine treatment. Prior to your radioiodine treatment, you have to go to Oxford 2 days in a row, because you've got to have thyroid injections. So you go in, and usually about 4 o'clock they do it. They do your thyroid injections. That increases your thyroid cells.
Right.
So there's more of a chance of getting the bad cells than the good. There's more chance of getting the bad cells to get rid of the cancer cells out of them.
Right.
Okay. So then you go in on usually I do the Friday, so Wednesday, Thursday, and Saturday. Wednesday and Thursday I go in for the injections. Friday I go in then, You have to have blood tests when you get there at 9 o'clock. I was really fortunate because this was the one before COVID, so Martin could come along with me, and you got to go on the cancer ward. You go into it, they show you your room, and it's all, you're on your own basically. You've got your own toilet, you've got a fridge that you can put your own food in, you give you a TV, computer, you have like 4 jugs of water because that's how much you've got to drink when you're in there for the day.
And it's a lead lined room, right? Because you take this isotope and you...
it's not, I don't think it's lead lined, but
Right.
I think the walls are really thick with concrete.
Right.
I think they're concrete walls because it doesn't seep.
Right.
So when Chernobyl, they were all buried in concrete, and the radioiodine doesn't escape from that. So I think the walls are really thick concrete, but there is actually a lead-lined screen for when the nurses come in to deliver my food.
Right.
And then it's really weird because the floor's got cellophane all over it. Everywhere, even like the buttons you touch or the handle you touch, is all covered in cellophane. Because when you sweat, the radiation comes out of your body. They ask you to shower twice a day when you have this treatment. So yeah, you seclude. You're on your own for 3 days in the hospital. You don't really see anybody.
And that was really hard for you as well because Harrison had just been born. He was like a couple of months old, right?
Yeah, he was only 6 months, 4 months old. 4 months old. Yeah, it was only 4 months at the time. And that's not difficult for me. That was difficult for me in a way, but that was also difficult for Mike because then I couldn't be with Martin, and he had to have a baby to look after for 3-4 weeks, I think it was.
Yeah, because after you'd had the treatment, you can't go near young children. You can't go near friends and family. When Martin drove you home from the hospital, you had to sit the other side of the car, and you could only be in the car for how long?
Could only be in the car for an hour.
An hour. And Oxford Hospital's slightly more than an hour away from where Lucy lives.
Yeah.
So you had to take breaks and things like that. Or drive fast.
Yeah.
Don't recommend that. Pray that there's no traffic. Okay. Yeah. And so, how do you take this radioiodine? Is it a pill or is it?
So, they got 2 people. It's called nuclear physics, or the people specialise in nuclear medicine. There's always 2 nurses, and I always have the same nurse that come and see me. So what they do is they told Martin he had to be by the room by about 12:30, 1 o'clock, because at 1 o'clock is when they say the time that they give you this medication. So that was the first round. Martin went about 1 o'clock. It's just it comes in like a lead pot, and they put it on your table in front of you, and it is just generally like a paracetamol capsule.
Right.
Okay. So the paracetamol capsule, the plastic coated one with the paracetamols inside. Literally just like that, but you can't pick it up to take it. They give you a tube, so the tube sits on the tablet. You lift the tube up, the tablet falls down, and then you take the water and swallow it, and they stand there and watch you do it. So you don't bite into it, because if you bite into it, it's just the radiation's in your mouth, it's not going anywhere else.
You really don't want that.
You really don't want that, no. So so you take the tablet, and then nuclear physics comes in. They check your radiation level, so they check your radiation level when you're standing up. They check your radiation level when you're laying down or flat on the bed. They check all that, and then they go. That's it. You don't. You have the nurse come 2 hours later to see if you're okay. You can. Prior to that, we should say this. Prior to having your radioiodine treatment, you have to go on a low iodine diet.
Oh yeah, we forgot about that.
We did forget about that. So.
How long before?
So 2 weeks before your treatment, you have to go on a low iodine diet. I usually say it's the vegan diet with meat. sort of thing.
Right.
So there's no dairy, limited on dairy products like your eggs, your milk. You're limited on like fish, not allowed to eat fish at this point. But you can have all the normal meat and everything. You just got to be careful of the iodine intake. It's not a no iodine. It's just low iodine. And eggs and milk have a high iodine, inside in it. So yeah, and then so you have your nuclear physics checks your radiation levels, and then you have somebody come in 2 hours later to see if you're okay, see if you get any side effects. Unfortunately for me, I had to have steroids because my neck was swollen, and actually at the time I sounded really funny when I was talking. So I was on steroids up until I left on Monday. I left on Monday and I was still on steroids when I came home. Because it causes your neck to swell and cause a little bit of pain in your neck. It is uncomfortable, but yeah, it made me feel sick, but it's not really a side effect to make us feel sick.
When you were in the room, you felt really sick.
Yeah.
They gave you anti-sickness meds,
which
right?
I took home because I was still feeling sick. So after 2 hours, you could go back to your normal diet. They deliver your food. You don't really see many people. They don't really come and see you. They only just drop your food off and that's that. Or if you've got an issue, they come and see you. And then on the Monday, Monday's when I get discharged. But they do the treatment on a Wednesday to Friday as well. So it depends when you have your treatment. So on the Monday, they tell me that I have to be ready for about 9 o'clock. I get picked up by a nuclear physics nurse. They take me down to, I think it is a PET scan. I'm not too sure. I go for a scan, and they check where the radiation is in your body. They check your levels to make sure that you've dropped enough, so you're safe enough to leave the hospital. Because as Christopher's just said a minute ago, that it damages anybody. It can damage a normal, healthy person's thyroid, and it can damage the kids. That's why the kids aren't allowed around. So get all the clear. They give me the restrictions. It's like a little yellow card, and it tells me how long I've got to be away from adults for, how long I've got to be away from the kids for, and all that. And usually it was about 3 or 4 weeks with the kids was the maximum that I've had. Since then they have changed it, and actually it's funny enough, I was allowed to see the kids sooner than I was able to see than mine being able to sleep in the same bed as me. So it has changed over the past few years. But yeah, just left, and then that was it. 3 or 4 weeks at home on my own. I had Mum come and visit me, or she stayed over the night, and she was allowed to be a metre distance from me. And then Mum cooked me dinner because it was easy, because she was cooking for everybody else, because Martin and the kids had to move to Mum's house. So it was easier like that. And I had my yellow card, so if I had to go to hospital or if I had blood tests, I have to take my yellow card to show people that I'm radioactive. Also, the funny thing is, if you go on holiday and you fly, you can set off the radiation alarms. So you have to have the card to prove that you're radioactive because of your treatment. It was quite funny because when we did go to Portugal, I did set off.
Oh, did you? I didn't know that.
I did set off some alarms. And Martin said I was glowing green when I had to do the full body scan. I don't think that was my radiation though, but that would have been quite interesting. So yeah, you can set the radiation alarms up in airports.
I didn't know that.
Yeah. And obviously I'm radioactive, highly radioactive in about 6 months.
Right.
So yeah, that was my first round, and then I can't remember how long it was till I had my...
But between the first round and your second round, did COVID happen then?
Yes.
And then, so maybe we should talk about what happened with COVID, right?
Right, yeah. I'm trying to think. Did I have my second round prior to... Yes, I did have my second round.
You had your second round.
I had my second round the week before they put us in lockdown.
Right. So you had it just in time.
So, yeah, that was interesting because COVID, the week before, obviously the hospital's policies and what they do were different. And I actually was told on the day that I went in for my second round that they didn't know if it was going to go ahead because of COVID.
Yeah, I remember now.
I remember now, yeah, that was a good shout. But luckily for me, they did go ahead when I was there. Exactly the same. Took the tablet, took the radiation capsule, had the pre-treatment, low iodine diet before, 2 weeks before, had the injection, went in, exactly the same process, take the capsule, you got your scan on Monday, and then you're free to go home and isolate at home. But yeah, the challenging thing is the week before, I had that the week before we went into lockdown. So we were in lockdown. How long were we in lockdown for? Weeks. So at this time,
yeah,
it was weeks, wasn't it?
Yeah, long time.
So I was on sick pay. I remember now, and then I think the furlough just hit then as well. Furlough rolled in then, and I wasn't put on the clinically vulnerable at that time.
No, and we were all pretty annoyed about that.
Yeah,
especially
and I was never being put on the red list for the flu injection either.
Right.
So I knew when this came along that I wouldn't be on there. So I was fighting. I rang the GP at this time and I was like, I've got cancer, I'm clinically vulnerable, but they're not saying that I'm clinically vulnerable. Nothing came through the door because they sent out letters, didn't they?
Yeah.
That you should stay at home if you're clinically vulnerable.
Because we didn't know what you should do, did we?
No, we didn't.
But the safest thing was to
stay at home.
Isolate fully.
Yeah. And then I rang. Who did I ring? I think I rang Macmillan, and then somehow it got all sorted, and I was put on the clinically vulnerable. So then that's when the letters came in to say that I should stay at home because it's not safe for me to be out. I just had my radioiodine treatment, so my immune system was low. It's suppressed, isn't it, when you...
Yeah.
Yeah. And then lockdown happened and everything went on a pause for God knows how long. It was about a year, wasn't it? So throughout lockdown, I had lots of issues with my feet. I was starting to get numbness and tingling feeling in my feet, and they thought it was because of my radioiodine treatment. Well, the GP thinks it's my radioiodine treatment. My consultant thinks it's not. It's completely, it's strange. So I was having a lot of pain, so I was having to go on amitriptyline, and then I've been on pregabalin now to sort out the numbness in my feet, and then pain. I was trying to get hold of my Macmillan nurse at one point, because I was trying to get answers from my consultant. I can't remember what it was about now. Something happened. I tell you what it was. I had low iron.
Oh yeah, so you're a bit anemic, right?
Yeah, I was anemic.
You're a bit white and...
Yeah, that was it. I was anemic, and that was the other issue I had, because I was anemic for about a year. And I was trying to fight for them to give me... Well, they gave me iron tablets. The iron tablets was making me feel sick. Couldn't take them. I was trying to get hold of my consultant to see if he could do something to help me, like have an iron infusion or something. Trying to get hold of my Macmillan nurse. I was told my Macmillan nursing through COVID had been deployed into a different section because of COVID. So I'm assuming that she went back to being a nurse of some sort.
And you've not had a Macmillan nurse since then?
I've not been allocated a new Macmillan nurse since, no. So I don't have any Macmillan support now than I did prior to COVID.
And but you had a lot of Macmillan support before COVID, right?
Yeah, I had a specialist nurse that specialised in rare cancers, and she gave me a lot of support. She was able to chase the consultant. She was able to chase Oxford, support me, like if I had any issues, she'd be able to support me that way. And then since COVID happened, I lost my Macmillan nurse, and I haven't had anything since. Also in that time, I had my consultant changed as well, so that's why we couldn't get hold of my consultant, because he wasn't going to become my consultant after COVID. Not sure what happened to him though. I think I'm not too sure. He still works for Oxford, but I think I've just switched on to a new consultant. And at that time, when you're used to one consultant at Oxford, and then you're kind of worrying and feel nervous about this new one, if he would have the same knowledge, or even have the same knowledge as my previous one.
And it turned out that he has a different way of treating the cancer, right?
Yeah.
Because your first consultant, they only wanted to do two treatments.
They wanted to do 2 treatments and then watch it, and if my levels of thyroglobin went up, then they would give me more treatment. But my new consultant is following, I think it's the French. I think he's following some regulations that the French follow, where you can have up to 4 treatments in a row, quite close together, and then see how it goes from there. So then, and then I think it was about a year till I saw my next consultant. It was quite a long time. And then I was booked in. When was I booked in for my last one again? I can't remember when I was booked in for my last one. So I had my third lot of radio ID.
During COVID. So during COVID.
It must
So
have
I think
been.
restrictions got lowered at some point, and then they said, okay, Lucy, you can have...
I think, that was in October time, wasn't it? Where it all dropped off.
Yeah.
Yeah, and then I had it again, didn't I? And then... that's about right. That October, wasn't it? I had it. And then we went back into lockdown in Christmas, wasn't we?
Yeah.
So then I was put back into
So that was
isolation
October.
again.
That was October 2021.
Yeah.
So by this time, we're nearly 4 years into your operations and treatment. Since you found out, since you found the lump on your neck, we're 3 years in up until that point.
Yeah.
Now, you're waiting on your next treatment?
Yeah, I am now waiting for my 4th round. So this will be my 4th and last one on a frequent basis. Unfortunately, we went to see the consultant on February the 3rd. And I went to see him and I signed my papers to say that I consent for this treatment to happen. And then I was told that there is a shortage of the radioiodine treatment. And I think they only manage... I'm on a waiting list, so I've been put on a waiting list. And I think they didn't... When I was in February, they didn't have a radioiodine capsule in February for some, but they didn't have... But they had one in March. So they had only 1 capsule in March, which wasn't me. And I am now still waiting 3 months later for a phone call to say that they've got that treatment in. But at the moment, we're on a waiting game again.
It would be really good at this point for you to have that Macmillan nurse to call up and get some support, right?
Right.
Because at the moment, you need to do all the phoning in.
Yeah, so I now have to chase it and find out where we are. Or, unfortunately, is there potential that there might be a longer wait because of what's happened in Ukraine?
Yeah.
And depending where they make the radioiodine treatment.
Yeah. So we're hoping... Right now we're playing a waiting game, aren't we?
Yeah, we are.
For the 4th
but they
round
knew
of treatment.
They knew we were going away, so they said that they would sort it out after we come back, but I've not heard anything yet.
And what were your most sort of recent results, and what sort of prognosis have they given you?
So my recent results were... my recent results were that he was hoping that I would be all clear after this 4th round, but he did tell me that I was only a 1 in 3 chance of being completely clear of cancer. At the moment, I think the cancer's getting smaller, but it's not going. It's still there, but it's not going to take my life away. It's just going to be longer in getting rid of it, really. Getting rid of the cancer.
And they've not ruled out a 5th treatment?
They haven't said anything about a 5th treatment. They can't do it as frequent as they've done it.
Right.
Because then it will start to cause more damage to me than it would getting rid of the cancer cells.
And there's other, I think that there's other forms of treatment as well.
Potentially.
In the future.
Yeah.
But they're
not,
like the last line of defence.
Yeah, and they've not said anything about those sort of treatments yet. But, like with this treatment that I'm on, I've got side effects from them, so they'll tell you all your side effects. So now I've got a permanently dry mouth, and actually they do tell you that your salivary glands get damaged, and actually I've got damaged salivary glands because I get painful cheeks, and they think that my salivary glands have now damaged. Right. So just about here.
What other effects has it had on your body?
Obviously, because of my thyroid, I can feel the cold, so my body doesn't regulate its heat very well, so I can feel the cold. I feel cold more often. Always tired. You go to sleep tired. You wake up tired. You get lots of aches and pains in your body sometimes. If my thyroxine isn't at the right level, I suffer from depression, anxiety. So it's all of everything. It's everything that, and your metabolism. Like I've put on weight since my thyroid issues, and everything. So yeah, it affects you. Like, it does change your life in how you are, how you feel, and all that sort of thing. So yeah.
What would you say to somebody that's just found out that they've got cancer, or thyroid cancer specifically?
So I would say enjoy your life, and life. You appreciate life more when you get diagnosed with cancer, and just to enjoy it and enjoy your life more. I know that you've just been diagnosed with cancer, or someone's been diagnosed with cancer, but just find things to do. Like when I was told that I had cancer, we go weekends away, we go to the beach, we go on holiday. We do a lot more now than we used to do before I was diagnosed with cancer. And I think, just make sure you always got that support. And there are days that there will be difficult days. I've certainly had many of those along the way, especially since my 4th round. When I was told that I was put on a pause, I think mental health wise it's gone downhill since then. And recently been put on fluoxetine, so been on it for about a week or so now. So they're quite happy with me at the moment at home.
And that's really helped. So those meds have helped you.
Yeah, well, the meds have helped because I spoke to Martin today actually, and he told me that it's the first week that I've not told him that I don't want to be here anymore. So for a little while now, I've told him every week that I probably don't want to be here anymore. And this about a week now, I've probably not said it yet. But I said that there's at home, obviously because of Oliver and everything, it's more challenging at home. So yeah, we'll wait and see. But enjoy life, there's.
I think that's a good motto to have for people that haven't just been diagnosed with cancer as well.
Yeah, life's too short now. Whether you've got cancer or if you've got cancer or haven't got cancer, just enjoy life because you never know what's going to happen.
Lucy's story and living it has really fueled me to want to do something to raise this awareness and do something big and challenging to push myself to live life like you're telling people that they should. So,
Yeah.
and to be able to help these amazing charities, you know, Macmillan has really helped you with your cancer journey and would have been there to support you. And maybe you might not have had some of these mental health problems that you're suffering with now if you'd been able to have a Macmillan cancer nurse. And cancer research as well has been mind-blowing, really. And we've kind of seen it from the perspective you're talking about France and their studies. You know, the more research that we can do into beating cancer, the more cancers that we can remove. So I think that's really, you've been a real inspiration to me.
Thank you.
So, tearing up a little bit there, sis.
I saw that, yeah.
Should we wrap up now?
Yeah, we should wrap up.
Okay. Thanks for coming along and listening to Lucy's story. If you've been affected anyway and want to have a conversation with us personally and Lucy, please reach out to us on the Facebook page. It's Facebook.com/SWCPCA. And we'll get your messages and I'll get Lucy to respond. If we have a lot of people inquiring to us, we might set up a different way of doing things. We might set up like a Discord channel or something like that where you can talk directly to Lucy. If you think that you've got cancer or you're worried, definitely reach out to Macmillan. They're the experts, and see if you can get help and advice from them. If you'd like to support the walk and anything that we're doing, please feel free to donate. If you can't donate, then please reach out to me and see if there's any help that you can give me along the way on the walk. I'd love people to join me along the walk. I have a number of people joining me at the start of the walk in Minehead, including my little sister. So come meet Lucy and talk to Lucy face to face on that walk. Yeah, I've got lots of people joining me along the way. On the journey, I'm trying to raise as much awareness and money as possible. So along the way, I'm going to be holding at least one photography workshop where I'll be doing, weather permitting, photographs of the Milky Way and doing astrophotography, and that'll be at St Michael's Mount, which is an incredible place. I have a photography page where you can go and have a look at my photographs there, and I really am going to spend time with you in the evening through the night, sharing how to create those amazing images. More to that to come soon.